Doctor, I'm really worried. I don't know what's happening to me. I've been feeling absolutely awful these past few days. Constant headaches that just won't go away, fever that spikes at random times, and muscle aches that make it hard to move. And to make matters worse, I just read something about Marburg disease. It sounds absolutely terrifying, like something out of a horror movie. Dr. Jones, a picture of calm and composure, nodded reassuringly, his demeanor a stark contrast to John's anxiety. John, it's completely understandable to be concerned after reading about something as serious as Marburg disease. But let's take a step back and talk more about what you're experiencing. Can you describe your symptoms in more detail? John went on to describe his symptoms in greater detail, mentioning not only the headaches, fever, and muscle aches, but also a growing sense of fatigue that left him feeling drained all the time, a loss of appetite that made eating a chore, and a nagging pain in his stomach that seemed to come and go without any clear reason. He had recently returned from a trip to Africa, which he knew increased his risk of contracting various diseases, including Marburg. I appreciate you sharing your concerns, John. It's important to talk about these things so we can address them properly. Let's talk about Marburg disease in more detail so you can understand it better. Marburg is a rare but severe hemorrhagic fever that affects both humans and non-human primates. It's caused by the Marburg virus, which is in the same family as the Ebola virus. The disease was first recognized in 1967, when outbreaks occurred simultaneously in laboratories in Marburg and Frankfurt in Germany, and in Belgrade, Serbia. The people who were infected had been exposed to imported African green monkeys or their tissues while conducting research. The symptoms of Marburg disease can be quite severe and typically include sudden onset of fever, chills, headache, and muscle pain. Around the 5th day after the onset of symptoms, a rash, most prominent on the chest, back, and stomach may occur. Nausea, vomiting, chest pain, a sore throat, abdominal pain, and diarrhea may follow. Symptoms become increasingly severe and can include jaundice, inflammation of the pancreas, severe weight loss, delirium, shock, liver failure, massive hemorrhaging, and multi-organ dysfunction. It's important to note that Marburg disease is not easily transmitted. It spreads through direct contact with the blood, secretions, organs, or other bodily fluids of infected people, and with surfaces and materials contaminated with these fluids. The risk of transmission can be significantly reduced by taking proper precautions, such as wearing protective clothing and practicing good hygiene. So, while it's good to be aware and cautious, there's no need to panic. We'll run some tests to rule out Marburg and other possible causes of your symptoms. In the meantime, try to stay calm and take care of yourself. We'll get to the bottom of this together. John felt a wave of relief wash over him. He knew he was in good hands and that Dr. Jones would do everything possible to help him. With a plan in place and a better understanding of his symptoms, John left the doctor's office feeling more hopeful and less anxious about the days ahead.